Police in Connecticut arrested 4 people who they say are responsible for the overdoses of 11 Wesleyan University students. All of the students survived, but 4 are still in the hospital with serious or critical injuries. Authorities say the 4 students arrested were linked to the bad batch of the drug Molly, or MDMA. Those students who were arrested have since been suspended. And what happened at Wesleyan has sparked a conversation, or it should at least, about the drug Molly. Joining us to further explain about this drug more in depth is Dr. Richard Chaffoo. Dr. Chaffoo, always great to see you.
Good to see you too, Jen.
Talk to me about this drug. We know the street name Molly or MDMA, but what is it really and what is it doing to those who take it?
So Jen, Molly is actually short for the vernacular molecule, and it's actually a form, if you can imagine some of the older drugs that were called Ecstasy, where they had amphetamines. So it's a very powerful stimulant. And the problem, Jen, with this drug is, of course, it's illicit and it's cut with a lot of other products. We don't know the dosing. There are cases of where there's actually been rat poison added as fillers or bath salts. And we've had patients come into emergency rooms really in dire, extreme situations where their temperatures get as high as 107, 108 degrees. You know, this becomes obviously a medical emergency. You want to get that temperature down. There's been cases of serious brain injury. Stimulants cause problems with life-threatening arrhythmias, ultimately dehydration, kidney failure. You know, I remember being a resident and one of the medical centers and being in the emergency room, one of the greatest fears of an ER physician was someone brought in, like from a college campus, from a drug OD, because you really don't know what it is. You do your toxicology screens, and it takes a while for that information to come back, and no one's forthcoming with the information, so you have to kind of fly by the seat of your pants. You want to stabilize that patient, but it can certainly be life-threatening.
Yeah, and you bring up such a good point, Dr. Chaffoo, about the mixing. That happened in this case in Wesleyan, that the police believe that bad batch basically had a bunch of different designer drugs in it. Let me ask you about the symptoms of an overdose. You mentioned the extremely high temperature. So what are some of the things that people should be looking out for, and also symptoms of if you think someone is abusing this drug?
Sure. Well, the obvious symptoms would be things like increased heart rate, palpitations, sweating, flushing, you know, a heightened sense of euphoria, hallucinations, acting strange or unusual. We know that with taking illicit medications, having a drug dependency, we see changes in people's behavior. They tend to become withdrawn. They begin to get, you know, caught up in terms of doing illegal things like stealing, robbing, and so obviously the symptoms that we see related to abuse can involve even things of feeling you have an higher level of energy, you're hypersensitive to music or lights, nausea, chills, sweating, blurred vision, dilated pupils are very common with such stimulants.
Dr. Chaffoo, we've only got about 20 seconds left, but you've been a doctor for a long time. We often talk about cocaine and heroin and ecstasy and sort of all the like traditional drugs, if you will. Are you seeing an increase in this drug Molly, and does it just kind of continue to morph and become popular on the street?
Well, that's a good point, and there's certainly an increase with the outbreak of these students at Wesleyan College, as you mentioned, and certainly the problem is that, as you said, they do morph. So you might find one drug, but it can very easily morph into something else, and it's very hard to track these, but they're extremely dangerous and certainly potentially fatal in many cases.
Yeah, well, it's certainly a good conversation to have and at least get people aware of what's going on out there. Dr. Chaffoo, thanks for joining us.
Pleasure, thank you.
All right, coming up here.